Mark Lorenzato, talking to you about how to manage congestion. Congestion of the head, either nasal passages, ear canals, the throat, any head sinus, is frequently a problem following a viral infection. When you get a viral infection, your immune system kicks in within about 60 hours. You've eliminated the virus, yet you have a remaining large population of white cells in your tissue that causes you misery. The white cells, in response to any infection, release histamine. They will continue to release histamine in response to dust and particles and whatever they could perceive as an infection following the eradication of the virus. So you have to deal with a histamine-rich state. When histamine is released from white cells, it causes the local blood vessels to leak. That's what causes the congestion. Its effect on nerve endings is pain or itching. Taking an antihistamine is the first step, but you have to manage the major side effect as well. When you take a non-sedating antihistamine like cetirizine, which is Zyrtec, or loratadine, which is Claritin, or other, you will then get rid of much of the release of histamine from white cells, but you will also cause your membranes to be dry. To manage dry membranes, don't plan on just sipping plain water. It won't work. You have to have some sodium and sugar in the solution in order to pump those across the membranes of the stomach and small intestine, and then water is absorbed. I recommend using apple juice or other juice, 1 part and 3 parts water. Mix them together and sip those following the use of over-the-counter antihistamines when you're congested. The next thing you can do is intermittent use of a decongestant. Decongestants like pseudoephedrine, ephedrine, and phenylephrine all tighten blood vessels. This means all these membranes that are leaking, that are secreting, no longer secrete. But there are serious problems with too much decongestants. First of all, they're stimulatory, hard to go to sleep. So you can buy them when they're mixed with a first-generation antihistamine. Phenylephrine with chlorpheniramine is my favorite. Phenylephrine with brompheniramine is a liquid form of the same medicine. When you use these medicines, including the phenylephrine with chlorpheniramine, use it as 1 tablet twice a day, twice per 24 hours, no more. Decongestants will work dry membranes out, interfere with your immune system, but also they are effective through the nervous system. If you use too much of them, you make more receptors, and they will not work as well the second day. This is a huge problem with decongestant, with pseudoephedrine, with the strongest decongestant. That can be reserved for flight, when you really need your eustachian tubes to open up to cause less pressure in your ears. Avoid guaifenesin and robitussin. This is my job security, people using guaifenesin and robitussin. They are expectorants, they promote cough. I many times have patients who have had a viral sore throat, head congestion, take guaifenesin or robitussin or Mucinex, whatever, any form of guaifenesin and dextromethorphan, and come in with a cough 4 or 5 days later, not being able to sleep and miserable, all for the sake of taking the wrong medicine. Please avoid guaifenesin, avoid dextromethorphan when you have head congestion. That's pretty much it. If you have allergies, I recommend using a nasal rinse throughout a viral illness and following it, and a steroid nasal spray. The effect of the steroid nasal spray is to eliminate many of the white cells, and therefore they will not be releasing histamine. You will do better. The last thing that I find very fascinating is histamine, which will cause your blood vessels to leak and more congestion, is also found in food. So you will want to eat low histamine diets when you're congested. People who have chronic allergies will wonder why one day they're so much worse than the other. It's that good salmon, avocado, and wine they had the night before, all high in histamine. Great, thanks. This was long, but to the point. You're going to use a non-sedative antihistamine, sip some juice, occasionally use decongestants, use a nasal spray if you need to, avoid foods high in histamine, and you'll do well. Thanks.